Hey, good Saturday afternoon. Hey, I don't normally do videos on Saturday, but I want to do a continuation from yesterday. And this is on pre-diabetes. We have a lot of veterans that's living with pre-diabetes, and hey, you kind of want to stop that right in its tracks, and it's something that can be reversed. So you said, what is pre-diabetes? It's a condition where the level of glucose, which is your sugar, in your blood is above normal. If you have prediabetes, you are at risk for type 2 diabetes. Type 2 diabetes is when the level of glucose in the blood reaches a certain high level. And with prediabetes, it has not reached that level yet, but it is still higher than normal. I'll just go over a couple of the normal levels and the pre-diabetes level. A normal, a fasting glucose, doing a fasting glucose test, a normal would be less than 100 milligrams per deciliter. Okay. Um, and then pre-diabetes will be 100 to 125 milligrams. I'm sorry, milligrams per deciliter. I think I said that wrong on the first one. But here's some, and now this chart here is actually a lot bigger, which you can get this same chart from www.nutrition.va.gov. Okay, and now there's some factors that increase the risk for prediabetes and diabetes. One, if you got a family history of type 2 diabetes, uh, being overweight or obese, being age 45 or older, not being physically active, being African American, American Indian, Asian American, Hispanic, or Pacific Islander, having high blood fats, uh, and having high blood pressure greater than 130 over 80, and also Agent Orange exposure. So just out of that right there, I know I'm looking at about five of those pertain to me right now. So that's why I'm making some drastic changes. So um, that's why I want to do this as a continuation from yesterday. This is like really important. So hang in there with me. Um, Healthy lifestyle changes. Pre-diabetes can develop into diabetes if left untreated. Diabetes is a serious health condition. It is important to make lifestyle changes to lower your blood glucose and improve your health and prevent diabetes. So this is something that can be prevented. Increase your physical activity. You should get at least 30 minutes of exercise 5 days a week. So 30 minutes could be walking right around the block. I mean, it's different ways you can get 30 minutes in, but hey, you got to cut your chances and give yourself, put the odds in your favor and get those 30 minutes in 5 days a week. Achieve and maintain a healthy weight. So if you're overweight or obese, aim to lose at least 5 to 10% of your current weight right now. And even a small amount of weight loss can help prevent or delay diabetes. So it's just some small, subtle changes that we can make in our diets, and it can make a huge difference. Um, Work with your registered dietitian or nutrition to make a plan to eat well and be more active. So I'm telling all you veterans, you can go right there to the nutrition, get an appointment with the nutritionist at the VA, and they can get you on a good plan to get your levels down. Which you just have to do that. We talked about eating healthy on yesterday, eating your grains, which are whole grain, pasta, bread, cereal, brown rice, your vegetables, peppers, your protein, which that protein needs to come from lean meat, like chicken, fish, your lentils, beans, and tofu. And your dairy should be low fat or fat free yogurt and milk. And then, as far as your fats, use olive oil, walnuts, avocado. Avocados have a good fat. Limit your sugar sweetened. Limit sugar sweetened beverages such as fruit juices, sodas, sports drinks, energy drinks. All that stuff is loaded with sugar. So, to make a big change right now, I talked about it yesterday. You just got to turn that package around, look at it, and read that label, and see exactly what's in there. It makes a difference when you read that label because sometimes it'll scare you. You don't believe that you've been putting this type of stuff in your body. I mean, so this is what only thing you can do. Improve your habits. Limit alcoholic drinks to 1 drink per day for women, 2 per day for men. Uh, and discuss the use of alcohol with your doctor. I wouldn't hide that. I mean, if I drink, I'm not a drinker, but if I was a drinker, I definitely wouldn't hide that from my physician, because they need to know so that they can make a game plan that'll work for you. Quit smoking. Ask your healthcare provider about VA smoking programs. They actually have a program for smokers. So the resources are there at the VA. We just have to find out what they are, do a little investigation, ask questions, ask that primary care, and then see if they can get you on the right program. So we just got to do something about it. I'm not going to go. I'll go over a few other things here, but the rest of it you can just go on to the VA website and get it. Increase your intake of non-starchy vegetables. Vegetables are low in carbohydrates and calories and high in fiber. Eat vegetables for variety, nutrition, and to fill you up. And there's some non-starchy vegetables like your asparagus, your cucumbers, tomatoes, your broccoli, green beans, yellow squash, cabbage, onions, zucchini, carrots, spinach, and lettuce. So those are non-starchy vegetables. You want to have more of that in your diet. And then also eating earlier in the day. Eating earlier at night before you go to bed. You don't want to eat right before you go to bed. Try to eat in the area of 7:30ish. I know it doesn't always work out that way for us, but just consciously, just try to eat earlier so that you give your food a chance to digest. And then check your blood pressure and check your blood sugar levels on a regular basis. So I'm actually tracking mine twice a day. So I'm doing it in the morning and I'm doing it at night. So I don't want that to creep up on me. I'm like everything like borderline, so I really don't have any room to wiggle. So I just got to stay on point with everything that I'm doing. And hey, there's other veterans out there. I know you can't just ask somebody their personal information, but you could always say, hey, you ever been tested for diabetes, pre-diabetes, anything? It might be your brother or your sister. It might be your mom or your dad that just haven't seen the information that we can get through the VA. So just bring it up. You might be saving a life. So my saying, you see a veteran, help a veteran. I am out.